So hi guys, my name is Gellis, and of course this is Foot Care Nursing with Gellis. So now in this video, we will be looking at 5 mistakes that people living with diabetes should avoid. All right, so who I am, of course, we are a foot care nurse. We are located in Brampton, Ontario. And of course, if you do need our foot care service, definitely the information is in the link below or on the screen under. You could see our website and our phone number. So here is mistake number 1. So ignoring foot check. Basically, if you're diabetic, of course, you definitely want to make sure that you check your feet daily, hourly, however it is, as much as you can. So in this case, I said ignoring daily foot check. So many people don't check their feet daily. But of course, for diabetic, this is very critical. Even as a small cut or blisters can become infected very, very quickly. Avoiding inspecting your feet morning, evening, night, whatever. If you avoid checking your feet, it actually can be, not all the time, but can be very detrimental. So you definitely want to check your feet daily itself. All right. So mistake that diabetic, of course, patient may do or clients may do is walking barefoot. So I know you may say it's your home itself, but walking barefoot around the house, of course, outside may feel comfortable. After all, what this is my house, right? This is my home. But it may increase your risk of cuts, infection. You want to always wear either socks or proper fitted shoes, comfortable shoes. And when I talk about shoes, I want to make sure that your feet have enough space at the very top of the toes here. You want to make sure you have a wider toe butt shoes. And of course, we'll talk about more in the next, of course, video. All right. So mistake number 3, guys. Mistake number 3 is improper toenail trimming. So that could be a yes and a no for some, depends on how the shape of the toe is. So let me just explain. So cutting toenails too short, rounded, the edge can cause ingrown toenail. So in this case, it may yes for some people, and again for some people no. So the reason why I'm saying that, because when you see feet, pretty much in your career, then you understand sometimes if you cut it straight across, it may works. Sometimes again, it may not work. So in this case, avoid cutting it yourself. You want to definitely get a foot care nurse to handle the situation. So that person is able to, because they are knowledgeable in that area. And of course, they're able to know, of course, when and how, when to cut it straight, when to cut it V or curve. So it all depends. But you don't want to do it yourself, of course, as a diabetic, someone that is diabetic. All right. So mistake number 4 is ignoring dry skin and cracked heel. Don't ignore it, guys. So dry, cracked skin is not cosmetic. So you definitely don't want to say, when I cream it and that's it. No, you want to always make sure that you don't ignore it. Give it high attention. So it can be an entry point for infection, right? So you just don't know, especially if you're under that condition. You definitely want to ensure that you check. You always moisturize your feet. So moisturize daily, but avoid putting cream between the toes. It reduce the risk of fungal infection. So in this case, if you have to moisturize your feet, there's no problem. Just make sure you dry between the toes very well. And also, you always want to make sure you maintain a clean pair of socks. Is something I want to add there as well. You don't want the socks to stay on too much, because it could actually cause moisture in there, and all this fungus could get in there. And definitely, you don't want that as itself. So you want to make sure you're dry between the toes, cream your feet. Always check your feet and make sure you're dry between the toes once you moisturize itself. If you have dry skin, definitely. So mistake number 5. So skipping professionals' foot care. Yes, guys, you don't want to skip that. So many diabetics try to do self-treatment for themselves. It all depends on the age. We have to look at the age and the factor there. But for the most part, you definitely don't want to do it yourself if you're in that critical condition. So and you want to treat corns, callus, ingrown nails at home, you definitely want to call a foot care nurse. You definitely want a professional to do that there. This can be dangerous from some individual. No, I am not categorizing everyone, but for the most case, like for instance, for the seniors who can't reach their feet, there's different challenges. It could be dangerous. So always see a trained professional, either a podiatrist, of course, or a foot care nurse for safe care in this aspect. All right, guys. So there you have it. These are the 5 care mistake diabetic shoes avoid. So taking small steps today can save you from serious problem, of course, tomorrow. All right. So if you found this helpful, of course, please give it a like button, subscribe for more professional tips. And we try to come more and more itself to give you more professional tips here. Again, my name is Gellis, and this is Infinite Modesty Design. Please, if you are in the area of Brampton, Mississauga, Toronto area, or you want a specific foot care nurse to come to your area, the information is on the screen. Also, you could check the link in the description below. And of course, we are there to help you with happy, healthy feet. My name is Jaleese. See you on my next live. Take care.